Hello, my friends, and welcome to the Essential Liberties podcast, where we talk about life, liberty, and the pursuit of truth. Today, we're going to talk about masks. I'm sure we've all believed that we have heard enough about masks, but we certainly haven't heard the end of it. It's an ongoing debate. Two sides seem to disagree. Do they really work? Do they not work? We're told to believe the science, but what does that really mean? Joe Biden, if he assumes the role of president, has said that a nationwide mask order is certainly on the table. Now, whether or not that means masks as we've been wearing them inside, when we're around people, when we can't distance, or whether that's going to mean that we need to wear a mask when we're alone in our car or out for a walk, that remains to be seen. Right? But today we want to take a look at the actual science behind this. We're told all the time, you got to believe the science. We got to believe the scientists. Well, what does the science really say? Not what are the scientists saying, but what's the real science? We already know that Dr. Anthony Fauci told us not to wear masks, and then reversed that decision saying that the only reason he said that was they were concerned with masks being available to those people most at risk, the doctors, the first responders, the medical professionals. So it's already been clear, to me at least, that they're willing to lie to us to produce a result that may not be what the science is. So today we're going to look at not what the scientists say, but what the actual science says. What do the studies say? Because this topic has been studied. And I think before we do that, what would be important to do is take a look at the timeline. This has been going on for some time, much longer than the 15 days to stop the spread that we were all promised. But what has the advice been, and how has it changed over time? So if we take a look at where we're at with masks, and this is an article from Real Clear Politics, and it just takes a look at what's the timeline on this. And starting back on January 31st, around the time that President Trump instituted the travel ban from China, PolitiFact, Snopes, they got involved, and they told us that wearing a mask as protection was fiction. It didn't work. Right? PolitiFact on January 31st said in their Reader's Guide to Misinformation about the coronavirus that the likelihood of people catching the virus is minimal, not at least for now. Moving forward to the 28th, which I believe is one day before Dr. Anthony Fauci told us that we had nothing to fear from this. Right? Fact checkers then pointed out, and NPR reported, that infectious disease experts are hesitant to suggest that people wear masks as a preventative measure because they can provide a false sense of security. And we'll talk more about that later. But that trend continued fairly consistently. Right? In March, right, an article said, stop sharing myths about preventing the coronavirus. Here are 4 real ways. And what they concluded was, according to the World Health Organization, only people who are infected with the virus need to wear the mask. Now, if we fast forward in time just a little bit, the advice remains wash your hands, cover your cough. Now, washing hands is interesting because that's also been studied. And we know a little bit about, based on the science, how washing your hands actually affects the spread of the virus. And it's a lot less than you actually think or have been told. Now, if we take a look now, moving into February, for the first time we start to hear, and this is from the CDC, that people who are sick, who have the coronavirus or are under investigation and not hospitalized, CDC starts to recommend that they wear a face mask around other people or when entering a healthcare provider's office. Still in March 9th, though, we're told that we don't need to wear them. Right? The CDC repeats the advice again. Right? Face masks are in short supply, and they should be safe for caregivers. Right? Now, it was not until about April 3rd that the CDC's guidance changed to everyone should wear a cloth face cover when they have to go out in public. And this was kind of previewed a bit by Anthony Fauci before that, saying that once we knew that medical providers, healthcare providers had sufficient masks, we might have to talk about whether or not everybody should wear them. So again, from the first cases of this very early in the year up until April 3rd, we were told a couple of things by the CDC, the World Health Organization, Surgeon General of the United States of America, that masks didn't work, and that masks, in some cases, could make the situation even worse, could make the likelihood of spread even a little bit easier. Now, on April 3rd, they went to everyone should wear a cloth mask. And I think that's important because there's a couple of different types of masks that we're dealing with here. There are respirators, N95 respirators, that provide a level of protection and filter out the air for the person wearing it. There are surgical masks designed to be worn in a surgical and a sterile environment. And then there are cloth masks, bandanas around the face that make us all look like would-be bank robbers as we go about our business, neck buffs, cloth masks with elastic over the ears. You've seen them all. Right? But do they really work? And we're going to take a look today at what the actual science says, and we're going to look at those three categories. What does the science say about an N95 respirator that provides protection to the wearer but not to someone else? Surgical masks, which are a form of, a minor form of source control, right? Eliminating all of the aerosol of the virus that can spew from our mouths as we breathe, as we cough, as we go about our day. And then cloth masks, the various pieces of cloths and bandanas. So we're going to take a look at all three of those categories. And what does the science say? Again, not what do scientists say, right? Not what people are telling us to believe and backing it by saying we need to believe the science. But what does the real science say? Because what's interesting is people use various devices to try to prove their argument, to avoid having to try to defend that argument. People will say things like, well, everybody knows that, or the experts agree on. Now it seems like another form of that has been, well, the scientists say. You got to believe the science. And we're told that about many things. We're told that about masks and coronavirus. We're told that about climate change. You've got to believe the scientists. You've got to believe the science. Well, a lot of people are using that when they want you to believe something that they believe, but can't or are unable to defend that using the facts. So let's take a look. And what we're looking at here is something that was published in PubMed. PubMed is a great resource. It's a repository for most of the published peer-reviewed medical studies that have been done, as a way for other scientists, other researchers to keep up on what's the current research on particular topics, to read those papers, to understand what has already been studied as perhaps a basis or informing the studies that they plan to do. Now, I've got a copy of that in a PDF, which just allowed me to do some highlighting, and it's what you see here. But where we found that was in PubMed, and if you look at the title, it says a rapid systematic review of the efficacy, so do they work, of face masks and respirators. The distinction there is face masks being something like a bandana or a surgical mask, and respirators that actually contain a filter in the mask, and you see that with the N95 mask, there's a little bump on the side that when you breathe in, the little valve pulls in. When you breathe out, it moves the other way, right? And so it looks at those as their efficacy against coronaviruses and other respiratory viruses. Coronavirus being new, a lot of the studies take a look at how similar viruses have been spread, and they break this down a couple of different ways. They look at it in the community. So how effective is it to wear a mask on your face to prevent the spread as you go about your daily business? How effective is it for a healthcare worker? And then for a sick patient, does it control the source of the virus so that other people don't catch it? So it breaks it down several different ways, right? But this is the actual science. And so what these individuals did is they systematically reviewed randomized controlled clinical trials of the use of respiratory protection, right? That's in the methods section right here. And what they came up with by searching all the available studies that were out there, again, this is a synopsis of the research that's already been done. This isn't original research. What they found was a total of 19 randomized and controlled trials, and they included them in the study. 8 of them were done in the community setting, 6 in the healthcare setting. Now, before I get into the actual studies here, I want to say this. I'm not against masks. If they help other people, if they control the spread of this virus, I'm all for them. Now, I'm certainly not going to wear them in my car by myself. I'm not going to wear them when I'm out in the woods on a hike or hunting or things like that. But if I'm around a lot of people and I can't avoid that situation and it helps somebody else or helps me, I'll gladly put the mask on. That's not the point of this today. It's not to say that masks are good or masks are bad. It's to say, as independent thinkers, what does the actual science tell us about, is this working or not? Or is it just something that's giving us a false sense of control, of security? It gives us the sense that we're doing something when really this is largely out of our control. So does it work? Right? I'm not going to look at the results. We're going to take a look at the individual studies. They make some conclusions here, and I'll tell you what that is. Generally, the conclusion is, well, they don't work very well, but they may work better than nothing, so you should probably wear them because they don't do any harm. And I'm going to contest whether or not they do any harm, at least certain aspects of them, based on some of the research. Right? So let's take a look where we have here. Right? When this was studied, the World Health Organization recommended surgical masks for healthcare workers providing care to coronavirus patients. CDC recommended something different. They recommended the use of a respirator. So from the review of all of these different studies, it says, in general, the results show protection for healthcare workers and community members and likely benefits of masks used as source control. So source control is if you are sick, if you have it, or maybe you don't know you have it. And the idea is we've been wearing the mask because we don't all know when and if we have it. Some of us do, right? But others don't. But that conclusion, I think, is a bit of a stretch, but I'm going to let you decide. Right? As they take a look at these studies, and I'm going to start here. Okay. One particular study here, this is a North American study. It says, we conducted a randomized control trial comparing the target strategy tested in the 2 North American studies with the wearing of respiratory protection during an entire shift and showed efficacy for continual but not targeted use of a respirator. So we're not all in a hospital. Where they tested it in the hospital where these infections are most prevalent, they found that if a doctor wore an N95 respirator from the moment they got into the hospital or the facility, the care facility, to the moment they left, not just when treating patients, because this is in the air, if they wore it consistently throughout the entire shift, there was some benefit to wearing it. But if they only wore it intermittently when providing specific care to people who were infected, the conclusion was there was no difference between a surgical mask and the use of a respirator. So surgical mask now is that other category, right? Where it doesn't actually filter anything out of the air. It just provides a block between you and other people. Okay? To summarize that, they said targeted use of respirators only when done in high-risk procedures and medical masks use is not protective. So intermittent use of respirators or the use of surgical masks, not protective according to this study. Another randomized control trial we conducted in China showed efficacy for continual use of a respirator, but not for a mask, and also found that fit testing of the respirator did not affect the efficacy. So a couple of different studies saying the same thing. If you wear a respirator, something that filters out the infections in the air, and you wear it continuously, you have some benefit. But if you don't wear it all the time, or if you wear a surgical mask, you're not afforded any level of protection. Okay. Another study that was done, right, and this was specifically done on a strain of COVID, SARS-CoV-2. In this study, it said we showed lower rates of infection outcomes in the medical mask arm compared to the control, but the difference was not significant. So this study, with the use of a surgical mask, said that there seemed to be some small benefit, but it was not significant. So essentially, it was not outside the margin of error. Now, if we take a look at another study, and this is the one I really find interesting, and this was a study conducted in Vietnam. Layered cotton cloth masks compared to medical masks. Okay? This to me is interesting because while we do see some medical masks that people are out there wearing, for the most part, we see these kind of improvised masks, the bandanas, the neck buffs, the the hand-sewn masks with the kittens on them or whatever you do to make it a little bit more fashionable. In that trial conducted in Vietnam of layered cloth cotton masks compared to medical masks showed a lower rate of infection in the medical mask group. That's designed for that. But here's the thing. It showed a 13 times higher risk of infection in the cloth mask arm. So if we were to speculate on this, I'm not a scientist, but if we were to speculate on this, the fact that you're wearing a piece of cloth up against your face, and this virus is in the air and it's circulating around, and it gets trapped in that cotton mask. And originally, the Surgeon General of the United States, I don't know if he cited this study, but he did say that evidence supported the fact that wearing the cotton mask could be harmful. And I think this may have been the source for that. I can't confirm that. Now, 13 times higher is a very significant increase in risk. And when I see the people running around, and I specifically think of my kids, 5 and 10, they are attending school full time, running around in cotton masks. Now, thankfully, they're in a demographic that is virtually unaffected by this virus. Unless they had multiple serious comorbidities, coronavirus is not going to affect them. It just doesn't affect the young. Now, it may have some effect because they can carry it. It may have some effect in them bringing it home to me. I'm 43 years old. I'm not in the high risk category, but there is some risk as we get older. Where it's a significant risk, though, is the little kids running around with the cloth masks in a school environment, in a store, wherever it may be, among other people, and having something on their face that is 13 times, according to this study, and it's a small study and it's one study, but that is 13 times more likely to have them contract the virus than if they wore nothing. Because you see, the surgical masks maybe were slightly better according to the study than nothing, but essentially within that margin of error, 13 times more likely. You know, my son comes home, and I'd say 50% of the time, the mask that was this way is now this way when he came home. It's wet, it's in his mouth, it's on his forehead, it's dropped on the ground. But yet we're asking these young kids who are not affected by this, they can carry it but aren't harmed by it. We're asking them to put these things on their face that make them more likely to become a carrier and then bring that home. And maybe that doesn't affect them, but it may affect me, and it certainly could affect the older generation, the grandparents, the aunts and uncles. As this paper says, this study suggests cloth masks may increase the risk of infection 13 times higher. And now it says that may not be something that's general to all at-home made masks because they're all different. The design, the adequacy of the washing, those all may be a factor. And there's no other study to confirm this or refute this. But 13 times. Are we preventing the spread, or are we increasing the spread? And I would say this again, this is speculation, and I'm not a scientist. In most of these instances where you have a surgical mask being worn, it's being worn by a medical professional. That's what's been studied so far in the studies that have been cited here, who are working in not a sterile environment, because there's infectious diseases in the air, but in a relatively clean environment with the knowledge of how often these things need to be replaced because they can't be washed. How often do they need to be refreshed in order to provide this level of protection? I would posit that a surgical mask in the hands of my kid or the average person that throws it on the dash of their car, picks it up, puts it back on their face, is probably no better than the cloth masks in this study. Again, that's my deduction. It's not science, right? But I think it explains maybe why some of these things turned out the way they are. This article goes on to take a look at several other studies. One looking at household spread, so people that were in the hospital that were sick with the flu, I believe, they were sent home. Were their family members more likely to contract? It found no significant difference between the two groups. It also goes on to say that this study was prematurely terminated and didn't meet recruitment targets and had several other problems with the reporting. Again, we look at these studies and we say, well, this doesn't look like major scientific investigation into these topics, and you're right. That's never been done. Because in the past, at least in my lifetime, we've had infections, we've had the flu, but we've been able to mostly manage them. They've been manageable. So we're looking here, we're really digging, but this is the science. We're digging to try to find, or these researchers are digging to try to find what's ever been studied, and then there's very little. There was a study here of people attending the pilgrimage, the Hajj to Mecca. Some were sick, some were not, some wore masks, some weren't. The problem was they found that compliance was extremely low. Many of the people that were supposed to wear the masks in the study didn't wear the masks, and people that weren't supposed to wore masks anyway because they were around a large amount of people. Again, not a great study. It showed some small rate of reduction in household infection, but nothing that we can really draw conclusions from. The writers of this paper that did this digging, they do come to some conclusions. And essentially they say, well, we should wear them because they're not harmful and they might provide some benefit. And so why not even if it has a small effect? And I would agree with that. I would dispute the fact that is the conclusion of this study, that there's no harm that can come from this, when the only data we have on cloth masks says it is 13 times more likely to cause the infection. And if we look back at the CDC's recommendations, that's what they're recommending. They're recommending cloth face coverings. They're not recommending surgical masks replaced every half hour, which I understand is the guideline in a non-sanitary environment. They're not telling us to wear respirators. Respirators protect us, but they don't protect the spread, at least in theory, or what some people are conjecturing from this. So what it's asking is that we wear them. Right? That comes from data, and it says here, the trial, which did not show efficacy used with influenza, which is a rare outcome, requires a larger sample size. So the study was too small. Not everybody contracts. It's somewhat rare, so you need large sample size is basically what they're saying. But despite the conclusion of this study that we should wear them, the researchers in the original study note that the trial did not show it was effective. Why are they saying that it did? I think because we hoped that it would. Some other conclusions are drawn, yes, for healthcare workers, respirators, start to finish of shifts. I think that makes sense. But again, another study that was done, and this is the one that's the last one that's noted here, the two trials which showed no difference are widely cited as evidence that masks provide equal protection as respirators. And what they're referring to here is a study, and this one kind of contradicts what we've seen before and says that the mask didn't work. The two trials which showed no difference are widely cited as evidence that masks provide equal protection as respirators. However, without a control, the absence of difference between arms could reflect equal efficacy or inefficacy, and it's not possible to draw any conclusions about efficacy from this particular study. This is really a mess, and we go, well, why hasn't this been studied? It just hasn't been an issue. But this is the science. This is the best of the science that is available. Another study here, medical masks did not significantly protect against viral, bacterial, or droplet or other infectious outcomes. There's some other studies here with sick patients. Did they take it home? If it was worn, did that help the people around them avoid the infection? And like most of these studies, it's riddled with the disclaimers, right? Not based on good evidence. Despite being the World Health Organization's only recommendation for masks used by community members during COVID-19, it is supported by the smallest body of evidence. What I conclude from this, and I'll leave your conclusion up to you, is we don't know. We really don't know. In fact, the only thing that really stuck out to me in this whole thing, that really hit me, was the fact that the one study that looked into it showed that these cloth masks that we're wearing are not effective. Not only are they not effective, they are 13 times more likely to cause the rate of infection. So I think what that says to us is if we're going to wear these masks, we certainly need to replace them. We need to wash them. We need to maintain them. And not just put that dirty old rag up against our face that is literally soaked with whatever's in the environment around us. And that may be these diseases that we're trying to affect. But these are the masks that we're being told to use. The science, if it supports anything, it's the continual use of respirators to protect the person wearing them. That there's some efficacy in that, not in the community even, but within hospitals. That's where it's been studied. But the surgical masks, the cloth masks, the ones that we're all wearing, here's the science. Not what the scientists are saying, because again, the scientists have proven that they're willing to lie to create a response, a behavior in the public that they consider to be desirable. They did that when they told us that we shouldn't wear masks. Nothing in here to me says that we should. Some of what's in here said that maybe there's a benefit. But on the other hand, some of it says what we're doing is wrong. This is the science. Take it how you will. Take it for what you conclude. But at the end of the day, we're being asked to do something. We're being told that it's what the science dictates. But is it really? No, I think what's important is that as individuals, free thinkers, that we stop taking what people tell us, or stop taking and believing what people attribute to the science. Take a look at the science. It's not hard to find. I did one search. This was the first and second result. And I took a look at it, and it was what I was looking for. I thought I'd have to go through and look at all these reports myself, all these studies myself, and try to draw some conclusions to piece it all together. But someone's already done that. They looked at they searched the keywords. They dug into the details. They summarized it nicely for us here today. So as individuals, go to the source. Go to the source. Go to the information. Go to the data. Go to the science. Don't let anybody tell you what the scientists say until you can confirm it yourself. Because the scientists are not the science. Scientists and science is used by people that can't or won't or are not able to support their argument with the actual facts. It's all here for us, folks. You make your own decisions. I'll continue to wear a mask when I'm in large groups, if only to make other people feel comfortable. If only not to send them into a panic. But ultimately, does it work? That's up to you to decide. Thanks for stopping by today, my friends, to the Essential Liberties podcast, where we talk a little bit about life, liberty, and the pursuit of truth. How to find that truth. Thanks for listening, and I'll look forward to seeing you again. You have a fantastic day.